All right. Welcome everybody to our chiropractor event, and we're here with Dr. Kayla Calhoun. So we're going to just go over a few housekeeping things. So I do want to let you know we have a check-in form, and it's mainly to help your counselors know where you're at. You can use the QR code or the bit.ly link. And then we also have a great questions document. And so these are really great questions to ask the presenter. I know you get a lot of information from these presentations, and sometimes it's like, I want to know everything, but what do I ask? That would be a perfect document for those. And then we also have an evaluation form. And so for high school students, I would really like it if you guys fill this out. This is what gets you guys, this is what gets your career credit. So just watching the event is not enough. You also have to fill that out. Again, be fully present. Feel free to turn on your camera. When we record these events, you won't be showing up. So if you are comfortable, feel free to turn off your camera or turn on your camera. And try to stay off your phone and, ask questions in the chat. And then again, with the evaluation form, just not to forget. And then, so if you guys, we're going to have a Q&A session at the end. So if you guys have any questions, feel free to drop them in the chat and then throughout the presentation, and we'll get to them at the end. Alrighty, I think that is it.
All right. Hello, everybody. Let me just share my screen quick. Okay. So, can everybody hear me okay? Yes. Okay, sounds good. All right, so I am a chiropractor here in Hillsborough. I graduated about 6 months ago, so most of my expertise is with the process of getting into grad school and with starting a new business. So if you have any questions, especially about that stuff, I don't really cover a lot about how to start a business in my slides, but feel free to ask me questions about it. That's definitely most of what I do now is the business side of things, but I kind of just wanted to give you an overview on what it's like to go from high school to how to, get into chiropractic school, how to become a chiropractor if you're interested in that. So a little bit about me. I originally grew up in Iowa, and I grew up in Urbandale, which is a suburb of Des Moines, which is the capital of Iowa. I went to Iowa State University for my undergraduate degree, and I have a Bachelor of Science in Kinesiology and Health, kinesiology meaning the study of movement. And then I went to Bloomington, Minnesota to Northwestern Health Sciences University for my Doctor of Chiropractic degree. And now I live in Hillsborough, and I own a small clinic called Stepping Stones Chiropractic. That is my corgi. Her name is Penny, and she's adorable. And then up there in the corner, that's my classmates. It's a really small program typically, so there's not a lot of people in it, which is kind of nice. So my undergraduate degree, focusing in kinesiology, there was a lot of anatomy, there was a lot of exercise, there's some like physiology classes in there, which is stuff that I was really interested in at the time. So being in Iowa State, there was a huge school, which was a lot different from my graduate school, but it ended up being really good for me. I did a lot of observation hours. I was actually originally going to be a physical therapist when I entered undergrad. And it wasn't until about my senior year of my undergraduate degree that I figured out that I didn't want to be a physical therapist and that I wanted to do a little bit more direct patient relationships. And so I decided to go the chiropractic route, which is similar, but also very different. And if you have any questions about PT school, I also know a lot about that. So my chiropractic school is very small. It is in a small suburb of Minnesota. The building actually used to be a middle school. So it's very, very small program, but a lot of anatomy, a lot of really intense basic sciences at first. And then I was able to come out here in the last year of my graduate school career to intern with a local chiropractor, which is how I ended up owning this business. So what is a chiropractor? So technically, the medical definition of it is a practitioner that manipulates the joints. So misalignment of the joints. We treat what is called a subluxation, which is our term for when a joint is malpositioned or not moving correctly. So each joint in your spine is supposed to be able to move independently of the ones around it. And when it's not, that's what typically causes pain. It can cause tingling, it can cause headaches, it can cause a bunch of weird symptoms. And that's typically what I'm looking for is the subluxation. So there's a little illustration here of like what the definition of a subluxation is. It kind of means something different to every chiropractor, but that's a good little, general guide for it. We are classified as alternative medicine, meaning that we are non-surgical care and non-pharmaceutical care, meaning that we don't prescribe drugs, we don't, do surgery, and we are typically the route that people take before they go to surgery. So I like to call us like the middlemen of medicine. When you start having weird pain, when you are, not sure what's causing it, typically people will come to a chiropractor first, and then we can kind of let them know what's going on and let them know if they need surgery or if they need to go to a primary care for maybe some pharmaceuticals. But we are mostly responsible for integrative care. Typically, I work with physical therapists, I work with acupuncturists, I work with naturopathic doctors to kind of give a full picture of what's going on with that patient. So to get into chiropractic school, so you don't actually need a bachelor's degree in some states, most of the states, I think. I think it's about half of them that you are required to have a bachelor's degree before entering chiropractic school or before being licensed at least. But at least for my school, we needed 90 college credits total. And a certain amount of them had to be in human biology, human anatomy, chemistry, and organic chemistry. So you just needed the prerequisite classes to kind of prove that you have a baseline for what the curriculum is going to be. And then the 3.0 GPA requirement in undergrad or in those college credits. We needed 2 letters of recommendation. One of them had to be from a chiropractor and the other one could be from really anyone. Just like a character reference kind of. And then there was an application and then I had to do an essay. But overall, the application process is super easy for chiropractic school. It's like, if you can tell them why you want to be a chiropractor, they will work with you. I know a lot of people that never took organic chemistry and were able to get in chiropractic school just fine. So once you're in grad school, it is a little over 3 years. Some programs are a little shorter, some are a little longer, and it is year round. So you don't get summer breaks. We got like breaks in between, trimesters or quarters, but no, long summer breaks anymore. It was kind of, that was kind of a bummer. But the first year of chiropractic school is the hardest by far. It is all of your basic sciences, all of your anatomy labs. You actually work with a cadaver lab, meaning that you dissect a human body. It's very, very fascinating to do, but a lot of people were kind of grossed out by it. And that's when you have the most intense curriculum testing wise. I know for me, I had one trimester where I had, I think 40 or 45 tests within 3 months. So it's very intense to do. It's, kind of putting your nose down and doing it, and you just have to get through it. But for us, it all kind of went by really fast. Our second year, you start learning the adjusting technique. You start learning when not to adjust somebody, when it's okay to adjust somebody. You start learning a little bit about specialties. So, and I'll get into the different specialties a little bit more later, but there are tons of different ways to be a chiropractor. There's animal chiropractic, there's kids, there's older people, there's, anywhere in between. And then you start learning a lot about diagnosis, which is, to me, by far the most important part of being a chiropractor, is that you have to know what's going on with somebody and you have to know what you can do to help them. We learn a lot about x-ray and radiology and how to read an x-ray. And that's important too. And then the third year of school is usually where your internships are, where you go into a working chiropractic clinic and you work with that chiropractor and you're under their license and you get to treat real people with real pain. And that's where most of the learning happened for me, at least. That's where, we got good at patient interaction. So in order to become a chiropractor, once you have the degree and once you're all the way through school, there are 4 national boards exams that you have to take. Usually, actually, the boards exams happen during school. So about halfway through school is when I took the first board exam. And then in the last year of school, I took part 2 and 3. And then right before I finished, I took part 4. They are stressful and and they are like an 8-hour commitment for each part, but they are definitely not as intimidating as they seem when you're in school. For the state of Oregon, since I moved from Minnesota, Minnesota chiropractors and Oregon chiropractors can do different things. It's all very state specific. Each state has, this is what you can and can't do. This is what your scope of practice is. That's what that's called. So for Oregon, there are state specific boards because in Oregon, chiropractors can do a lot more than other states. Most other states don't allow you to do quite as much here as here. So there are state specific boards to make sure that you are capable of doing those things. So there's 3 different Oregon state boards. They were all 50 question multiple choice tests. It wasn't, too bad, but it is something to keep in mind for the state of Oregon. Like if I were to practice in Washington, I would not have to do that. And then there's a background check, fingerprinting, and then you have to register with the state. But, and then you are licensed to practice in Oregon. So once you're licensed, what can a chiropractor do? So here in Oregon, we are classified as primary care physicians, meaning that you don't need a referral from a medical doctor or a DO to come see a chiropractor. You can, start with us and we can refer out to other practitioners if needed. That's, kind of what the primary care definition means. It also means that we are the ones diagnosing people instead of relying on other practitioners to tell us what's wrong with somebody. We do our own diagnosis. So these are where the different specialties come in. So you can do sports medicine, which is kind of my niche, my specialty. A lot of what my patients come in with are, athletic injuries or sprains or strains. That's all classified under sports medicine. Chiropractors can do prenatal, postnatal care. So a lot of pregnant women will come and see a chiropractor when they are having low back pain, which comes with most pregnancies. And it tends to really help. And then we can also treat their kids once they are born. I know chiropractors that will be at the hospital with the mother and adjust their child minutes after birth. And it's very popular and it's not something I do, but it is something that I know a lot of chiropractors that do that. And then geriatric patients, meaning elderly over the age of 65. I have a decent population of people that are older. Your body aches a lot more when you're older. So it gets a lot more common to see older people. And then besides that, there's animal care. Some people want to take their animals to a chiropractor. In the state of Oregon, you also have to be some kind of veterinarian to be able to do animal chiropractic. In Minnesota and most other states, you don't. You just have to have a certification. They are actually very similar to adjusting humans. And then in the state of Oregon, we can also perform minor surgery and OBGYN services, which is, two of the state specific exams are around minor surgery, meaning nothing that requires us to cut you open. But like if you needed stitches, or if you, needed some anesthetic, a little bit of like pain medication, like we can do that. I don't do that because I don't want to, but but there are some chiropractors that have that extra certification and have the sterile surgical room, and you can go to a chiropractor for that here. And then OBGYN, meaning we can deliver babies, which again is something that I don't do. But chiropractic neurology is another specialty that is super fascinating. It's dealing with the brain and the coordination of the nervous system with the rest of the body. And, typically if somebody has chronic migraines, if they have pain that hasn't been resolved by anything else, usually I will refer to a chiropractic neurologist, because they can kind of look at what's going on in the brain, or what's going on functionally. And then a lot of chiropractors I know do a nutrition master's degree or a certification. Functional medicine is pretty common. And that's pretty similar to like naturopaths that will, prescribe supplements and stuff. That's the nutrition aspect typically. There are tons and tons more specialties, but those are kind of the main ones that I, interact with, and the main ones that I learn about. And what we can't do in any state, we cannot prescribe medication. We don't prescribe pain pills. We don't, tell people how much ibuprofen to take. We cannot tell somebody, stop taking your blood pressure meds, because that's not in our scope of practice. I'm not even allowed to have an opinion about those things with my patients. We cannot perform major surgery, which, thank goodness, I wouldn't want to do that, but but we cannot do anything that requires us to cut you open. And the minor surgery, even, we can't do anything without the extra license. We cannot give vaccinations, except for with COVID, we're granted the ability to give COVID vaccines. I don't know anybody that does, but we were granted the ability to, because we are primary care. And then we cannot perform like a psychological counsel. And then in the state of Oregon, we cannot do acupuncture, although in other states, chiropractors can. So typically what I treat, it's a very long list. It really is just about anything. I see a lot of like headaches, low back pain, random injuries, jaw pain, sciatica, which is like low back pain that shoots down your leg, tingling in the hands and feet. Those are like the most common ones that I see. And those are the ones that most people like think of a chiropractor to go to. Although I can, like I've had somebody come in thinking that they have like a kidney infection, and I can do a little exam to say like, yeah, you need to go to urgent care, or, you're probably okay, like this will settle down, or, go to urgent care later. But we see a huge array of problems, like knee pain, like osteoarthritis. I had a patient that was undergoing cancer treatment, and she had some muscle pain related to her treatment, and that's what I was treating her for. But yeah, there's a ton of different things that we can treat. So my clinic is Stepping Stones Chiropractic. I specialize in more sports medicine care, geriatric care, just because of the amount of patients that I have that are geriatric. I emphasize manual adjusting, meaning that the pushing and the cracking sound that like the stereotypical chiropractor, that's what I emphasize, although there are tons of different ways to adjust somebody that don't involve pushing on them, that don't involve this sound. Some people just hate it. And And I have a lot of, different methods, but typically that's what I do. I also work with the soft tissue around the spine and around the joints, because typically a subluxation in the spine will also cause the muscle to hurt, which is usually what people come in to see me for, is the muscle pain. So I will work with both. I also implement some exercise rehabilitation in my treatment plans, meaning I will give somebody stretches, meaning I will give them new workout ideas to kind of help alleviate their pain or to avoid more pain. I also employ a massage therapist who's an LMT, so she does therapeutic massage. It's a really good integrated team where I typically see people for the more joint stuff, and then if they can get in with her, she does the muscle stuff. It makes my job a lot easier. So for me, a typical new patient visit, if somebody comes in to see me, we'll start with the conversation. So like, why are you here? What brought you in? Have you tried anything else? What have you tried? Who have you talked to about this? What are your goals for, do you want to be able to walk better? Do you want to be able to sleep? Do you want to be able to pick up your kids? Like, those are important because that's what I'm working towards, is a patient's goals for functional movement. I'm not necessarily working to align their spine. That's kind of the stereotypical presentation of a chiropractor, is that people think that that's what we do. I am not aligning anything. What I'm doing is I'm using joint motion to get you back to functioning normally, or functioning to how you want to, or getting you back to work, or whatever your goals are. And then we also look at, why did this happen? Did you, fall off or fall down the stairs, or, did you just wake up with pain? Like, what could be causing it? How can we avoid that in the future? My examination is in order to diagnose the problem. So an examination includes range of motion. So, can you move this way without pain? How far can you go this way? Because those matter. Orthopedic tests, meaning that I push on your head. Does it hurt? Or, are you okay? Or does it make your pain worse? Because all of that is information for me to kind of go off of, to say, I think this is what's causing your pain, or I think this is an effect of whatever else is going on. I always do blood pressure and vitals, because if somebody's blood pressure is skyrocketed, then that could cause their headache that they come in to see me for. That could cause joint pain. That could cause inflammation and dizziness. And if their blood pressure is super high, that's not something that I'm treating, because it becomes then dangerous for me to treat somebody if they are at risk of, hypertension that can cause, a lot of issues later. I don't want to, make things worse for them. So it's really important to look at the full picture and figure out, is this my thing to treat? Is this within my scope of practice? Can I help them? Or do I need to tell them to go somewhere else? Do I need to tell them to go to the ER? Do they, are they even capable of tolerating my treatment right now? Or can we start small? So, and that's where the manual palpation comes in. Palpation just means touching. If I can't touch somebody without them, jumping off my table, that tells me that whatever I'm doing is too much for them right now. And, maybe we reevaluate, maybe we do a gentler approach, and then we kind of go from there. Usually my treatment includes the adjustment, soft tissue treatment, and then I retest everything that I just did that was positive to see if there's any immediate improvement. Most of my patients, when they come in, they see a difference right away, before and after the adjustment, which is really cool. It's really nice to be able to show somebody, like, this is what I did, this is what works, and we can go from here, but here's to show you what we can accomplish. Okay, so tools that I use. My most important tool by far is that table. So I have an elite chiropractic table, meaning that it's just a certain brand, but it's a hydraulic table. It goes up and down. And the little knobs on the side are what I can do to change the table for somebody. So like that middle piece comes up if somebody with a pregnant belly is in my clinic and they can't lay on their stomach. That is, it helps me to be able to still treat them. It also comes up underneath the patient and drops down, which is a form of adjusting. I push on their pelvis, the table drops out from under them, and it kind of uses gravity to adjust their low back if they don't want to be like twisted on their side. The headpiece up there also has a drop on it. So if somebody's neck is really stiff, really hard to adjust, then I can use that. The blood pressure cuff is just for my new patient or people that have new injuries. It's always something to keep in mind. That is something I had to get really good at in school because blood pressure is not easy to to get good at. It's very intimidating to do, but it becomes a lot easier over time. The tool in the top or the bottom left, that's called a goniometer. That is how I measure range of motion. So I actually use degrees. I don't just like guesstimate where they're at. I say like, oh, you moved 60 degrees. And then after I adjusted you, you moved 70 degrees. That is something that people want to see. And that's something that I want to see. That tells me that you have room to improve. And if the next time I see you, you're moving at 60 degrees again, I know that I can get you farther than that. The top left, that is electrostimulation therapy. I don't use it very often, but I do have a unit in my clinic. Typically, so it's just electric pads that you can put on muscles and it will stimulate contraction in those muscles. Really works to reduce inflammation. Also works to relax people. Again, I don't use it very often, but I have used it before and it works pretty well to kind of, help with the muscles. If somebody is so in pain that they can't handle a lot of muscle work with, my hands, then I can use that. So I have a little case study. I have a question about it. Feel free to just, have it in your mind what the answer is, or you can, tell me. But so this is actually a real case that I had, I think last week. So a 45-year-old female presented to me. She had never seen a chiropractor before. She had no idea what a chiropractor does, but I was her last resort because she was kind of, desperate for help with her pain, which happens a lot. Actually, I have a lot of people that have never seen a chiropractor before that they need reassurance that I can help them. They need reassurance that they're not broken, that they're, things will get better for them. She presented to me with left shoulder pain and then numbness and tingling in her fingers. And it was all of her fingers. It wasn't just some of them. It was like the whole hand. And she was very concerned that she had damaged a nerve because she works out 6 days a week intensely. She has a very athletic lifestyle. She goes to the gym at like 4:30 a.m. every day. And she doesn't let up. Even though she had this pain, she was still going to the gym every single day. She was still working out with the same intensity and it wasn't getting better. So she was very concerned. She was very worried that she had damaged a nerve or that she was going to need surgery. And then when I did my examination on her, she didn't have a ton of neck pain, but she did have neck pain when she turned her head to the right. So away from the shoulder that was hurting. And then when I pushed on her shoulder muscles in the front, the numbness and tingling got worse. And same thing with her neck. If I pushed on this side of her neck, the numbness and tingling got worse. So I treated her. I did her adjustment because my diagnosis for her is what's called thoracic outlet syndrome. It's it's kind of a catch-all term. It's not super specific, but in general, it just means that this brachial plexus, which is at the top there, it's a bundle of nerves that comes out right underneath your shoulder. It's, this huge interaction of muscles that happens right there. Right underneath that is a bundle of nerves that all branch out to different parts of your arm. So, and it's also arteries and veins. So it's a really complex area. And it happens all the time that these muscles here at the bottom, so that's the pec minor, and then towards the neck, that's the anterior scalene muscle. Those are super, super common, that it will kind of pinch off that nerve and cause numbness and tingling in the hand. And it's, it was likely made worse by the intense shoulder workouts, although it may not have been caused by that. Literally can be caused just by sleeping on it wrong, or by, how you hold your shoulders. It happens all the time. So what I did first, before anything else, is that I reassured her that, I have an idea of what this is. It will get better. It's nothing that, there's no nerve damage that I can tell. We do a lot of neurological testing to make sure that the nerve itself isn't damaged. It's just that it's angry or, getting pinched off by something, but that it's able to, the sensation comes back. So that is a really important part of informed consent, is informing the patient what is wrong with them, telling them what I think I can do about it, telling them how long I think it's going to take to get better, and telling them what I'm going to do, meaning I'm going to adjust her neck, which is something that not everybody is comfortable with. But I tell her, this is very safe. It's something that I do all the time. And it's, I'm not, putting your head in a position it's not already supposed to go in. So she was totally game. She was like, I am desperate for some kind of solution. So I adjusted her neck, I adjusted her upper back, and then I worked on those two muscles that are shown right there. She had an immediate improvement. She had almost no tingling after all the adjusting. I also used kinesiology tape on her shoulder to kind of hold it in a position that wasn't gonna, bring the pain back. But she was extremely happy. She was relieved. And that's kind of what that's what we're here for, is, she was concerned that she was going to have to get surgery. She was concerned that she was damaged forever. And that's kind of why I call myself like the middleman, is because I'm able to be like, no, you don't need surgery. This is what's wrong with you. Here's what I can do about it. And she can walk out feeling 10 times better. She said there was like a 90 to 95% improvement, which was awesome. So my question then is, going forward, what advice would you give her? So she told me, like, what can I do to prevent this from happening in the future? So we've got some options. One option is that, we can tell her, stop working out. Clearly it's making your pain worse. So you need to, give it a rest. Don't work out at all. We can tell her, buy some supplements to relax your muscles, because, sometimes the nutrition stuff can play a role. We can tell her that after every time she works out her arms, that she needs to stretch, especially those two muscles. Or we can tell her, we can refer her for surgery. So I guess maybe in the chat. Oh, well, I kind of gave you the answer already. So yeah, so the answer for me, I told her that she needs to stretch. If I were to tell her to stop working out, she would not listen to me. She would probably go to another chiropractor, because why would I tell her that? She works out 6 days a week and it's something that she loves to do. So I don't want her to stop working out, because movement is great. Movement is medicine, as we say. But, maybe stretching a little bit after, or modifying her workouts to not exacerbate that problem, would be a good idea. Buying supplements is not something I would recommend for her. It's not going to help these symptoms. although, it can help some other aspects. And then surgery, thoracic outlet surgery actually is a thing. They will go in and kind of cut off the interaction, or release the interaction between the muscle and the nerve so that it's not pinching anything off anymore. However, most people that have these symptoms don't need that. My job is to find out at what point do I then say, you need something a little bit more complicated. You need to go see somebody who can, get into that area physically and change it for you. But 99% of the time, they will get better with conservative care, which is what I'm classified as. And usually for surgical cases, they need to go through 6 or so weeks of conservative care before they'll even consider surgery, which is what we call a trial of conservative care. Because if it works, if it goes away, it ends up costing insurance a lot less money if they don't need surgery, and the patient then doesn't have to go through that huge, surgical recovery process. But some people do actually need it, which is my job, is to find that out. So for me, why did I become a chiropractor, especially versus a PT? I get that question a lot. What is it about chiropractic care that I love so much? I wanted a lot more personalized care. I wanted to, see my patients more often. I wanted to have a direct relationship with their health and with them getting better. Me going in and adjusting their neck and seeing that immediate improvement versus me giving them exercises to do that may or may not improve their neck. So for me, that was kind of like the main thing. I also really, really love the nervous system, learning about the brain and neurology in general. It was so fascinating to me. So being able to use that every day, knowing that the brachial plexus is where it is and where it goes, being able to influence that directly, I thought was really cool. I also really love musculoskeletal care. I think it's really awesome that there are so many different ways to treat muscle pain and skeletal pain and, joint pain. And usually we can make a pretty big difference, because musculoskeletal care is something that is, I think, kind of underrated. But if your muscles hurt, if your joints hurt, you're not able to live your life 100%. You're not able to move. You're not able to work out. You're not able to, do things with your kids for as long. So I think it's so, so important to get it treated, to get it, to maintain it, so that as we age, we don't, just start deteriorating and we don't just like say, oh, I guess I'm just going to be in pain forever, because it's just not true. And then I really love chiropractic because chiropractors see the body as a whole. So like if I have somebody that has hip pain, I'm not just looking at their hip. I'm looking at their hip and their low back and their knee and their upper back. And I'm seeing, why is the pain the way that it is? What can we do? What can we influence to correct it? And I think it's really cool because pain is not, one cause. There's variables to everything. And I think seeing, attacking it from kind of all angles is how we get things better faster. So the ideal chiropractor, in my opinion, and I know a lot of chiropractors that don't have some of these qualities, and it kind of depends on what you want to do with the degree, like how you want to do business or who you want to work with. But ideally, you would have, you would be friendly and empathetic, because you have people coming into you that have pain, that are desperate, that are frustrated, and you have to know how to separate, your own emotions from theirs. Because at the same time, you have people coming in that have, emotional aspects to their pain, and they will just dump it on you. They will tell you everything that's ever gone wrong in their lives. They will cry on the table, and it's something that it's something that not a lot of people talk about in school. But to be a chiropractor, you have to be empathetic to those people. You have to know how to talk to people that are in pain, all types of pain. Being analytical and having good communication skills, meaning, getting good at diagnosis, being able to look at something and see more than just that, more than just hip pain. You have to look at it and see, all the different aspects, everything that's in that hip joint that could be causing issues. And then communication with your patients to tell them what you think is going on and to reassure them that no, back pain does not last forever. This will go away. You are capable of moving again. You're not broken. Those are all really important things. Work ethic, especially if you own your own business, if you are your own boss, there's nobody there to hold you accountable except for yourself. And this job is very unique in that you get what you put into it. If I see more patients, I end up getting more money, or I end up getting more patients from that because they tell their friend. So I very much, the work equals the reward, which is cool. It's awesome because, some things in life aren't like that. And, I personally like that. If I work harder, I get more reward. A passion for healthcare, seems pretty self-explanatory. Like, you should want people to be healthier. You should want people to feel good. And then being open-minded and a good listener, because people will, like I said, they'll kind of dump their emotional burdens on you as well as their physical burdens. And it's important that you're able to take that on or able to separate it from your own life. Being open-minded, meaning that people will come in with their own ideas of what's wrong with them. And sometimes it's a little harder, but putting the ego aside and just being like, you know what, that's probably true. You probably are right about that. Or, accepting that you're wrong sometimes because, you're not always going to get it right. Somebody's not always going to respond to what you do or like your treatment plan. And that's okay. That just means that they need a different approach. And you have to be able to, as a doctor, say, this approach isn't working. Let's try something else. That's important. Being thorough, meaning that you aren't taking things at face value. You are, being thorough in your questions to them. You're making sure you have a well-rounded picture of what's going on. And then obviously being culturally sensitive, meaning, you're not judging somebody when they walk in the door based on any sort of face value thing. Especially in the last couple of years, there's been an increase in, patient intake forms that include pronouns and, being able to consciously communicate with your patients in a way that is sensitive to their identities, to their, their preferred name, even like, calling somebody Bill instead of William. That's patient care. So the downsides of being chiropractor, there are some. So paperwork is a big one. With every patient, you have a note, a visit note that you have to complete. And it gets really, really tedious because chiropractors typically see anywhere from 10 patients a day to 50 patients a day, depending on who it is, depending on how much time you spend with people. But the paperwork can really add up. It gets to be really boring, and it's easily the worst part of being a chiropractor is all the paperwork. Dealing with insurance is a personal nightmare. I don't love working with insurance, although I'm in network with most insurance companies. But getting approved by insurance, getting their visits approved, it's all a big insurance game and we have to play the game, but it's, no fun for anybody. But you obviously are going to have difficult patients. Not everybody can be amazing, although most of my patients are amazing people. There are a couple that, can be super passive aggressive or be mad at me because their pain hasn't gone away yet. And it's just, that's where the communication comes in. And people that are in pain are going to be frustrated about their pain, especially if it's been years or even if it's been weeks and they've tried everything. They're going to be frustrated. And I get frustrated when things don't respond the way that I want them to. So long hours is a thing for some chiropractors. My schedule is pretty normal, like 9 to 5 or half days. But I have friends that work weekends. I have friends that work until 7 p.m. or friends that start at 6 a.m. And that's just how things are. Sometimes it depends on the clinic. There is a reputation for chiropractors that you have to overcome, meaning that chiropractors are very stereotypically not treated like healthcare professionals. They, the way that chiropractic care started is a little different than how it is now. There's a lot more research now than there used to be. And it's a lot more widely accepted now than it used to be, but there's still people that, think that we're quacks or think that we don't know anything about anatomy or that we can't do anything or we're making things worse even. And there's always going to be people like that. Those aren't your patients. It's just letting it roll off your back. And then obviously school is expensive. Grad school is really expensive. So most, if not all chiropractors take out some kind of student loan. I don't think I know anybody that didn't take out student loans to pay for grad school. It's very expensive. That's a huge downside to it, but usually within your career, it's proportional to, they're not going to give you something you can't handle. So when you are a chiropractor, the job opportunities are actually pretty nice. You can go most places and find a job. You typically are not hurting for clinics that want a chiropractor. There are geographical factors. So for example, there's a chiropractic school on the northeast side of Portland. And because of that, a lot of people that graduate from that school stay around Portland. Same thing in Minnesota, around Minneapolis, there are tons of chiropractors. But if you go to South Dakota, if you go to Washington, it depends on the state, but there's also a school in California. There's a school in Texas. Like those areas are typically the areas where it's less in demand. There's more chiropractors there, but usually it's not that hard to find a job. So your job choices are associateship, meaning you're working for somebody else. Some other chiropractor owns the clinic and you are just there to help them with their patient load. And you're there to expand their clinic. With that, you have a lot less responsibility. You don't handle any of the payroll stuff. You don't handle the business expenses or the stress of owning a business. But also you typically don't get freedom over how many hours you work or who your patients are. And typically because of that, you also don't make as much in salary because your boss is the one that owns the clinic. You can start a practice from scratch, meaning that there's, a lot of startup cost to that. It's very stressful because you have to market yourself. You have to, put a lot of things up front and you don't know how successful you're going to be. There's no guarantees. But you also have complete freedom over what your clinic is, who your patients are, what your hours are, how you're going to market yourself, what your specialty is. And then your other option is to purchase an existing practice. Usually chiropractors that are retiring or moving will sell their practice instead of just closing it. And that's what I ended up doing is I purchased an existing practice. So I already had a patient load from that doctor that I automatically started with. So I didn't have to do marketing. I didn't have to, get patients to come in the door from nothing. I had a group of patients already. the issue with purchasing a practice is that you don't know how many of them are going to stay with you or how many of them are going to go find somebody else. And then usually finding the right practice to buy is the downside for that. If your technique doesn't match up with what that chiropractor did, or if their patient volume is not what you want, then it's really hard to change that after the fact. You typically have to find a practice that matches up with what you want to do. So in the future for chiropractors, we have some changes that we're hoping for. We don't know what insurance is going to look like for chiropractors in the next couple of years, but we have a lot of groups that every single year they lobby for more of an insurance involvement for us to be considered more healthcare providers and not alternative care. So we lobby for insurance to pay out more, for insurance to cover more, because sometimes it makes it really hard for people to get care if their insurance doesn't cover it. And we want people to get better. And then more changes is that in the last 20 years, there's been a lot of research done into chiropractic to show that, yes, it does help. Yes, there are, things about it that change pain or that change how you move. Researchers in chiropractic are so important and they're so in demand. We need more of them, more people that will do studies, that will write the papers. There aren't a ton right now, but they're working really hard. And we are actually seeing right now more involvement of chiropractic in research in American medical journals, showing like that the study that's on the slide right there is a low back pain protocol that states that, and it's actually a nationwide thing, shows that when a patient presents with non-specific low back pain, meaning they don't know what caused it, their low back just hurts, the first person they should go to is a chiropractor, which I obviously agree with, but it hasn't been very widely known until the last 5 or 10 years that chiropractic is really good at that. That's our specialty, is kind of, we're the spine doctors, we're the low back pain doctors. And I just think that's really cool that, we're starting to get that representation. So what I would have done differently in school, if I had known, especially going into or coming out of high school, that I wanted to be a chiropractor, I figured it out pretty late. I had about 6 months of my undergraduate degree left before I even considered chiropractic, but I would have done a lot more classes on exercise prescription. So how to coach people, how to talk to people about exercise, how to not make it super intimidating. Those are really important things to learn. And I had to learn that a lot later. Although, I think it's really cool now. I feel like I would use it even more if I had more of a baseline knowledge of it. I also would have, started exposing myself to chiropractic earlier. I got my first adjustment when I was like 16. And I think I probably would have, knowing that, I would have gone a lot more often and I would have exposed myself to it to kind of figure out why it works for me. And that, because it took me a long time to figure out, how to tell people chiropractic works, and they would be like, why? And I'm like, well, like it just does. But if I had known to, talk to other chiropractors, to be in a clinic setting, I would have had a lot more knowledge going into school. I also would have learned more about insurance. There aren't actually a ton of insurance classes that they give you. So I had to learn a lot of it on the job, which I would not recommend. It's very complicated and it's, really intimidating to learn. So I just would have prepared a little bit more for that. And then while you're in school, they provide a lot of free seminars for you to learn different techniques or learn different aspects of patient care. And I would have gone to a lot more of those. And then clubs were a huge part of my school. I was in a couple of them, but I would have probably joined even more of them because it's really cool to talk to other chiropractic students and to expose yourself to what they think about patient care or, the techniques that they're using, because there are hundreds of techniques. So overall, I guess, I love my job. I think it's awesome. I am biased, but I think it's the best job ever. It's a lot of work, but I wouldn't change it at all. I think I think it's really cool to be able to help people every day. And a lot of my patients are just amazing people that I'm so glad that I know them. And my classmates are also amazing people. I'm still in contact with a lot of them, and they're people that you are bonded forever to because you've been through a lot. But overall, I guess, I think I covered a lot of, the grad school stuff, but if anybody has any questions, I would love to answer some.
Yeah, we have a few in the chat. So in case we do go over 3 o'clock, because that's when our scheduled, I will have this posted on YouTube later. But start with the questions. So one says, do you need any other like special education to do pediatric adjustment? Like, do you have to do any more exams or?
So technically, no. You don't actually have to have an extra license or certification, although there is what's called a diplomate, which is it's like an extra certification on top of your degree that is provided by the International Council of Pediatric Chiropractic Care, I think. And it's a series of like 2 years worth of classes that are very specific to adjusting kids and babies and, figuring out the milestones that they're supposed to be at and how to approach it if they're not meeting milestones. Colic, digestive issues, breastfeeding, all of that is covered under that stuff. So most people I know that treat kids did go to, most, if not all of those classes, because it's intimidating to treat kids without that. But no, technically you do not have to have another certification.
Okay. And then thinking back when you were in high school, did you always want to go into the medical field or were you thinking of a different career?
I wanted to be a physical therapist after I was like 16, and I ended up having wrist surgery because I fell while ice skating and I broke my wrist and needed surgery on it. And that was how I was introduced to the medical field. So I knew from pretty early. I always was really interested in human anatomy. So I kind of knew I wanted to do something there. I did think about becoming a professor like of neurology for a while there, but mostly I kind of knew.
Okay. And then, so you said that you chose chiropractic care. I'm trying to say chiropractic and I don't think that's
Yeah.
right. But in in your last year of undergrad. So, but what was there any like thing specifically that made you choose that career?
Yeah. I did like 200-ish hours of observation with physical therapists, which is part of the requirement to get into PT school. And I was with like 10 or 12 different PTs, and not a single one of them liked their job. And they all kind of discouraged me from doing it just because PT school is way more competitive. They're like, everybody wants to be a PT. And then also, it was pretty, and it ended up being pretty boring for them once they graduated. And I didn't want that.
Okay, and I think you kind of touched on this, but would you choose chiropractic care as your career again if you were to do it all over again?
Oh yeah. Yeah. I love it. I think it's really cool. I think there's a lot of it that I hope will change. Like I hope the stigma is gonna, go away eventually. I hope insurance is gonna get better at some point. But I think it's awesome. I think it's a great career. I think it's really fun. But yeah, I would totally do it again.
And then what's the best advice you'd give someone who's interested in this career?
Um, I think the best advice I would give is to, to get good at talking to people, because that's easily the most important part of being a chiropractor is talking to people genuinely, learning about them. And it's not something they really teach you in school. So it's something you just have to, to learn to get good at, and, learn to ask questions, learn to relate to people.
Okay, and then this one, so do you work with people with arthritis, and what do you suggest for people who have it?
Yeah, I have tons of patients that have arthritis. So for me, what I always tell people is that if you have arthritis in one place, you probably have it other places, but it doesn't always cause pain. The issue is when arthritis starts causing symptoms. So my best advice for arthritis patients is always movement, is always that movement is going to make it better, is that continue walking, continue exercising, continue stretching, because osteoarthritis especially gets worse when you stop moving. It gets, worse when you're just sitting there all the time, because that's what it is just your bones, starting to degenerate with age. But it's really interesting to see people that get regular care with osteoarthritis versus people that don't. But I see great results with osteoarthritis patients.
Okay, and then so how much money do you normally earn?
So it depends on what you do with, with your career. So working for somebody else, typically you make starting out around like 50 to 80,000 a year. That's typically just a base salary. There's a lot of bonuses involved. Working for yourself, you get what you put into it. So my clinic right now, we make around 150,000 a year. I have staff to pay and I have overhead to take care of on top of that. But grossly, that's what I bring in. And it kind of just varies month to month for me. But it's different for everybody, and it's different state to state too.
Okay, and then I think some of the other ones are personal, and so I don't know if you want to take time to read them. Some of them really nice. One's a question: is it really bad to pop yourself 24/7? Some doctors recommend it, and others don't seem to mind.
I don't mind it. I think that I think there's like a thing. A lot of chiropractors are like, don't crack your own neck, don't crack your own back, because they want to be the one to crack you. But for me, I always tell patients that if it does crack, if it does make the noise, and if it does feel better and you can do it on yourself, that means you don't need me. It means the joint is mobile. It means that you're capable of self-care. But if you can't get it to move, or if it doesn't feel better, that's when you need me. That's when, you're not always getting the exact right joint to move that's causing the actual pain. Something around it might be moving. And it's really hard to like get the right spot when it's yourself. So that's usually what I tell people.
Okay, and I think that was the last question. Well, thank you for talking with us today. I really appreciate it. I learned a lot. So I kind of want to go to the chiropractor now. So, all right.
Yeah. Well, yeah. Let me know. I'm always open. I'm always here. So if you have any more questions, I'm, available to answer them.